Hello everyone, welcome back to my channel. My name is Shreya and on this channel I share everything about life in the UK and much more interesting stuff. So if this is something you're interested in, kindly subscribe to my channel and hit that notification bell icon to stay updated for my future videos. And today we are going to talk about that all doctors and most healthcare workers can relate to. The most annoying things we hear every single day. Spoiler alert, it's not life and death emergency. It's the things people say that drive us just a little bit crazy. So let's just have some fun with this. So the first scenario is for Dr. Google. Suppose a patient comes in and the next thing he says is, so doctor, I've Googled my symptoms and either I've got a common cold or I've got stage 4 cancer. And then in my head, I would be thinking, cool, right, okay. So why exactly am I here again? So, coming to Google, Google is a blessing and a curse at the same time. I always appreciate when patients come in and they've already Googled their symptoms and they've got an idea of what's happening with them and they're well aware. However, when you are trying to explain something to a patient that your symptoms sound like you've got a common cold, for example, or something more simpler, and then the answer or the reply you get back would be, "But Dr. Google said something else." So that's when my blood pressure goes high rather than theirs. So, this is something that we as doctors have to encounter, I would say, almost every day. The next would be the magic pill. The patient comes in saying, "Doctor, can't you just give me one pill to fix everything?" Yes, sure, yeah, if only. People these days want a single pill to fix everything, including weight loss, stress, insomnia, back pain, you name it. And in reality, sometimes all they need is lifestyle changes, but nobody wants to hear that you need to exercise daily and eat healthy. That just causes instant disappointment. The next would be, "I want medicine with no side effects." So, a lot of patients come in and just mention that they would like to start a medication for the problems they've got. However, they do not want any side effects. And I would be thinking, so basically, you want magic. Every drug has got potential side effects, even the simpler medications like paracetamol. It has got side effects as well. So, my job as a doctor is to weigh the risk and the benefit and then explain it to the patient so that they could make informed choice or decision about their treatment. However, explaining everything again and again could be quite annoying at times. The next would be the quick question. So, this one usually happens when I am literally about to leave the room or finish an appointment, and then the patient would say, "Okay, doctor, I've just got one more quick question." And that is when they drop their 10-year medical history and present a completely new complaint, which they didn't even mention when they entered the room and begin the consultation. So I've noticed this so many times since I've started my GP training, and the fact that I am always restricted with time. I've got a specific time slot for every patient. This could be very tricky. So, that quick question is never just a quick question, it's more like a Netflix series, to be honest. So, the next would be the antibiotic debate. A lot of times, patients come in and they give history that, "Doctor, I've had sore throat since last 2 days. Can I please have antibiotics?" I listen to their symptoms, and depending upon them, a lot of the infections usually are caused by the viruses. And if that applies, I explain it to them that your symptom sounds that you've got a viral infection rather than a bacterial, and antibiotics won't work. And then the patient goes like, "But the antibiotics did work the last time," or something like a friend of mine had a similar infection and the antibiotics did work. Now, antibiotics do not work for viral infections, but trust me, explaining this 100 times a week is a job in itself. The next would be read on Facebook. So, this one gets me every single time. People believe random WhatsApp forwards more than years of medical training. Patients would come in saying that, Doctor, I've heard turmeric water cures everything. Yeah, and apparently toothpaste cures acne too. So, internet is basically home of free Wi Fi and bad health advice. Doctors as customer service. Sometimes the patients think we run Amazon Prime. A patient would come in saying, Oh, doctor, can I have the scan as soon as possible or possibly today? Yeah, sure. Why not? Let me just pull out my x ray machine from under my desk. I mean, I work for the NHS and NHS is wonderful. However, the waiting times are real and it could be quite frustrating at times. But I definitely promise we are not hiding any MRI machines in the basement. So that was just scratching the surface. Trust me, every doctor out there has got a long list of these little things they hear every single day, and that could be quite annoying at times. However, being said that, it's part of the job, and at the end of the day, we love helping people. If you enjoyed this, kindly like the video, hit the notification bell icon, and subscribe to my channel to stay updated for my future videos and for more such videos. Also, comment down below what is the most ridiculous or the funny thing you've heard or come across as a healthcare. So, I'll see you in the next one, and bye for now.